In an emergency, it would really be nice to know which ERs are already full and which ones aren't. The state of Indiana collects that information every day.
The catch? You are not allowed to see it.
13 Investigates managed to get some of that data anyway, and it is a real eye-opener. So tonight, our Bob Siegel is walking us through the numbers.
He explains why state health leaders want to keep Indiana's hospital data hidden from the public.
She's not breathing.
This winter, many Indiana hospitals really struggled. Some patients had to wait days to get a hospital bed. Emergency rooms were overwhelmed and in a state of crisis, according to the Indiana Hospital Association. It forced many Indiana hospitals to move to diversion, a request to ambulances to take patients somewhere else. This is hospital diversion data obtained by 13 News. It shows emergency rooms and intensive care units at Indiana hospitals were in diversion status for nearly 19,000 hours in just September alone. According to this data, some hospitals remained on 24-hour diversion day after day for weeks on end. Diversion means a hospital's emergency room or intensive care unit is essentially filled to capacity. It does not mean that the ICU or ER is closed. In fact, if you walk into an emergency room, especially with a life-threatening condition, they are not going to turn you away, even if they're on diversion. But depending on the severity of your condition, you may need to wait and wait and wait. So, in a non-life-threatening emergency, say your daughter breaks her leg playing soccer, would you want to know which local hospitals are on diversion and which ones are not? If your answer is yes, too bad. The state knows that information, but it won't tell you.
We actually don't want people picking and choosing which hospitals they go to based on diversion data.
The state health commissioner is reluctant to give out diversion information. In fact, it took her department 79 days to provide 13 News with the data we asked for back in September. And it has now stopped giving us any diversion information at all. The state health department collects the data, but a spokeswoman says they don't keep it. It simply disappears after 24 hours.
The diversion data, when we take a snapshot of it at any particular time, it is really obsolete within the next 5 to 10 minutes because that's how quickly it changes.
It does change quickly, very quickly. But in other states, people get to see those changes as they happen in real time. Take a look at this. It's the system that shows emergency room and ICU status across the state of Georgia. At any given moment, Georgia residents can go online to see if a particular ER is normal, busy, overcrowded, or in severe diversion status. And it's updated every 60 seconds. It's intended for EMS crews, but the public gets to see it too. You can see the same type of diversion information for hospitals in Pennsylvania, Mississippi, Maryland. It's not kept secret. It's online every day.
More information is better, and making it available, we just think that's a better plan.
Ted Delbridge oversees the County Hospital Alert Tracking System for the state of Maryland, and he says there's a real benefit to making this hospital data public.
It keeps the healthcare system accountable to itself. The hospitals and the EMS system know that the public can view the information, and it makes them try to keep it as real-time and legitimate as they possibly can.
And some emergency room doctors here in Indiana say there's another benefit to releasing diversion information: community awareness.
I think it's good to be open-handed with that data, even if it's not real time, but very close to it, so people can have an understanding what's going on in their city, what hospitals are full, what hospitals have capacity.
But Indiana hospitals are not eager to share their diversion data.
You don't think this information in real time should be made available to the public?
I would have real concerns with that.
Brian Tabor is president of the Indiana Hospital Association.
We really want people in an emergency to get to the closest point of emergency level care. And I worry that a dashboard with a red light, or however it might be portrayed, might make someone think of a stop sign or a sign that says closed for business.
Well, I'm not aware of that ever occurring.
Officials in Maryland say there's not a single reported case of a patient using ER status information incorrectly. And Maryland's data has been public for more than 20 years.
If the information is presented in a way that explains to them what it is they're looking at, can make a reasonable judgment for themselves.
It's now been 6 months since Indiana's governor ordered hospitals to report their diversion information to the state health department. 13 News has filed a complaint against the department for not storing and releasing those records because you have a right under state law to see them. We'll keep you posted.